Let's continue this conversation. We're joined by the Aurum Institute's Dr. Priashni Subrayen. Dr. Subrayen, good evening to you and thank you for your time. Yours is a research body but also an implementing partner for the country when it comes to TB. Can I start with the question as to how big a setback was COVID-19 in the fight against TB?
Great. Thank you. Good evening, Polly, and good evening to your viewers. So yes, COVID indeed had a huge impact with our TB services, the lockdowns and the subsequent, just lack of movement and the major concern about contracting COVID. It had an impact so significant that over the last few years, the department has had to develop a recovery plan following the COVID pandemic. We've seen declines not just in testing rates, but also in the number of individuals that we diagnose. And therefore, the recovery plan really looks to regain and recover our services following the COVID pandemic. Yeah. And I have to admit, over the last few years, we have made significant strides. As a recovery plan, it advocated for newer ways to find, those additional cases that we have previously lost. Thanks.
Yeah. Well, in line with this year's theme then for World TB Day, and the theme is, yes, you and I can end TB. How far are we from reaching that goal of ending TB?
So in terms of the incidence, compared to our 2015, which is really the baseline that we use for the MTB strategy, we've actually, since 2015, halved our incidence. And I'm really like the theme, because there's some intentionality in it. It is an acknowledgement that no one sector, not the health sector alone, no one organization, no one individual can end TB, but there is a need for us to work together. And the I and you, it is really reflective of multiple, whether it's organizations, whether it's sectors, whether it is the communities, whether it is our individual patients. Yeah. We really cannot do it alone. And we need this joint effort.
Yes, one individual cannot end TB, as you've just said, Doctor, but the theme also, though, does emphasize the importance of being accountable as an individual. Mm-hmm. So what individual steps does one need to take if you suspect that you may be infected with TB?
Yes, and that's really important because, the health sector is there to provide the service. We really need our communities, our patients to be part of this. If they're having any signs and symptoms of TB, for example, a cough that is unexplained, a cough of any duration, according to our symptoms, you should seek help. But night sweats, and I know oftentimes, we've heard from survivors that they've indicated when they sweat at night, oftentimes they just shrug it off as, it's been one of those South African hot days or nights. But, when it becomes persistent, I think that we should really make sure that the community at large knows the signs and symptoms of TB. Cough, fever, night sweats, unexplained weight loss. And when any of those, they are experiencing it, that they should seek help from a health service as soon as possible so that they can get tested for TB.
Yeah. Final question to you, Doctor, and it's not a political question. It may sound like a political question. Geopolitics are very unpredictable at the moment, and our country has had its fair share of knocking heads with the United States, and that country also happens to be one of the key funders when it comes to programs like these. Are you worried about funding cutbacks?
I'm not. And I say this because having attended the World TB Day event today, Mr. Trollis, who is the Deputy Director or Mission Director, Deputy Mission Director for USAID, he reaffirmed the commitment of the United States government towards eliminating TB in South Africa. And, as the Minister of Health announced, the Accelerate USAID-funded flagship project, which will be implemented in South Africa over the next 5 years. We really look at this mechanism to providing the support to help accelerate TB elimination in South Africa. So no, I'm not really concerned.
Dr. Priashni Subrayen, thank you very much for your time.